Right now, for vitamins sitting in your medicine cabinet could be doing more harm than good. A major study just found that seniors taking these common supplements had double the risk of nerve damage, heart problems, and faster cognitive decline. Before you take another pill, you need to hear this. In the next 10 minutes, I'm going to show you 4 vitamins that research links to serious health problems in seniors, and 4 nutrients that could literally add years to your life. One of them reduces your risk of death from all causes by 36%. Stay with me because the number 1 vitamin mistake could be the reason you're not feeling your best. Here's what most people don't understand about aging and supplements. The body at 65 processes nutrients completely differently than it did at 40. Your liver works slower. Your kidneys flush less efficiently. Your gut absorbs things differently. And your nervous system becomes more sensitive to excess. A vitamin that was perfectly safe at 45 can become dangerous at 65. Not because the vitamin changed, but because you did. Same pill, completely different outcome. The problem is supplement labels don't tell you this. Most doctors don't have time to review every bottle in a 15-minute appointment. So the information gap stays wide open and millions of seniors keep taking vitamins that are quietly undermining the very health they're trying to protect. But once you understand what's really happening inside your body, you'll never look at your supplement bottle the same way again. Let's start with the 4 vitamins you need to reconsider immediately. Number 1, vitamin A in the retinol form. Vitamin A sounds like something everyone needs. It supports vision, immune function, skin health. And in the right form and right amount, that's absolutely true. The problem starts when the form is retinol, the synthetic version found in most multivitamins, and when your body can't clear it the way it used to. Vitamin A is fat-soluble. It doesn't flush out through urine like water-soluble vitamins. It stores in your liver and fatty tissue. Month after month, year after year, it accumulates. And when your liver slows down with age, that retinol doesn't disappear. It builds up silently until it starts causing real damage. Robert, 67, took a senior multivitamin for 3 years. The label showed 2,000 micrograms of retinol palmitate. He never read the fine print. Over the past year, he developed increasing joint pain, dry, cracked skin, and persistent brain fog he blamed on getting older. When his doctor finally checked his vitamin A levels, they came back dangerously elevated. The retinol had been accumulating the entire time. Research published in the European Journal of Clinical Nutrition found that seniors with elevated vitamin A levels had significantly higher risk of atrial fibrillation, an irregular heartbeat that dramatically raises stroke risk after 65. The safe upper limit for retinol is around 700 micrograms per day for women and 900 for men. Many senior supplements exceed that without anyone realizing it. But here's the fix. You don't need to eliminate vitamin A. You need to switch to beta-carotene, the form found in sweet potatoes, carrots, and spinach. Beta-carotene converts into vitamin A only when your body actually needs it. There's no risk of overdose because your body self-regulates. Retinol doesn't give you that safety net. If your multivitamin contains retinol or retinol palmitate, have that conversation with your doctor today. Number 2, iron supplements without a confirmed deficiency. Iron has been marketed to seniors for decades as the solution for fatigue, weakness, brittle nails. And for people who are genuinely deficient, iron can be life-changing. But here's the part almost nobody explains. After 60, the vast majority of seniors don't need extra iron. And for those who don't, taking it anyway is one of the quietest ways to damage your organs. Iron doesn't flush out. It stores in your liver, your heart, your pancreas. Men stop losing iron after puberty. Women stop after menopause. Without active blood loss from surgery or another confirmed cause, your body has no efficient way to get rid of iron it doesn't need. So it accumulates. And accumulated iron causes oxidative stress, where unstable molecules damage healthy cells and accelerate tissue aging. Gloria, the woman from the beginning of this video, had been taking a multivitamin containing 18 milligrams of iron for 4 years. She was never tested for deficiency. She just assumed the iron was doing her good. Chronic fatigue, brain fog, joint discomfort. When her doctor finally ran a serum ferritin test, her iron stores came back significantly elevated. The iron she'd been adding every day had nowhere to go. A 2018 study in Alzheimer's Research and Therapy found a direct connection between excess iron levels and increased dementia risk in older adults. Seniors. Magnesium, vitamin D3, omega-3 fatty acids, and the combination of vitamin D3 and magnesium together. The action steps you can take today are simple. Check your multivitamin label for retinol, iron, and high-dose B6. Ask your doctor whether those are appropriate for your situation. Get your vitamin D, magnesium, and iron levels tested if you haven't recently. If you're taking calcium alone, talk to your doctor about adding D3 and K2. And if you're not currently getting enough magnesium or vitamin D, those are two of the most impactful gaps to close. You now have a clearer picture than most people ever get of what's actually happening inside your body when you take a supplement. That knowledge is yours to use. If this video helped you think about supplements differently, drop a comment below and tell me which one surprised you most. Share this with someone over 60 who takes a daily multivitamin. It could genuinely matter for them. Medical disclaimer. This video is for educational and informational purposes only. It is not intended as medical advice or as a substitute for professional healthcare guidance. Always consult with your physician or qualified healthcare provider before making changes to your supplement routine, especially if you have existing medical conditions or take prescription medications. Individual health needs vary, and what works for one person may not be appropriate for another. Other research links iron overload to heart disease, liver damage, and elevated cancer risk. The symptoms of iron toxicity, fatigue, joint pain, memory problems, heart palpitations, look exactly like normal aging. Most people never suspect the cause. Here's your action step. If your multivitamin contains iron and you haven't been tested for deficiency, ask your doctor for a serum ferritin test. If your levels are normal or elevated, switch to an iron-free senior multivitamin immediately. Iron is essential, but only when it's needed and only in amounts your body can actually use. Number 3. Calcium taken alone without vitamin D3 and K2. For decades the message has been simple. Want strong bones? Take calcium. It's in every pharmacy, every bone health ad, nearly every senior multivitamin. And calcium is essential. Without it, bone density declines and fracture risk rises. But the way most seniors are taking calcium in large doses alone without the right supporting nutrients isn't protecting bones. In many cases it's damaging the heart. Here's why. When you're young, your bones absorb calcium efficiently. Hormonal signals direct it exactly where it needs to go. But after 60, that system weakens. Bones absorb calcium less effectively. And the calcium that isn't absorbed doesn't simply disappear. It migrates into your arteries where it hardens blood vessel walls. Into your joints where it contributes to stiffness and pain. Into soft tissues where it causes calcification that's extremely difficult for your body to reverse. Calcium doesn't work in isolation. It needs vitamin D3 to be absorbed from your gut. It needs vitamin K2 to be directed into bone tissue and kept out of blood vessels. It needs magnesium to prevent it from hardening soft tissue. Without those partners, calcium is essentially unsupervised. And unsupervised calcium in an aging body is a serious problem. Multiple studies have found that high-dose calcium supplementation without K2 and D3 is associated with increased risk of heart attack and stroke in seniors. The better approach is to prioritize calcium from whole foods. Leafy greens, sardines with bones, yogurt, almonds, chia seeds. If supplementation is still necessary after that, it should be combined with D3, K2 and magnesium, not taken alone. And the dose should be discussed with your doctor based on your actual dietary intake and blood levels. Number 4. High-dose vitamin B6. B6 is water-soluble, which is why most people assume it's completely safe no matter how much they take. The logic seems sound. Water-soluble vitamins flush out. They don't accumulate. Nothing to worry about. But B6 is the exception to that rule. And ignoring that exception can cause serious, sometimes permanent damage. When B6 is taken in high doses over an extended period, it doesn't simply pass through. It builds up in nerve tissue. And over time that buildup becomes toxic to the very nerves it's supposed to support. The condition is called peripheral neuropathy, and it involves progressive damage to nerves in your hands, feet, and sometimes legs. Research published in the journal Neurology found that older adults taking high-dose B6 supplements had roughly double the risk of developing nerve damage symptoms compared to those who stayed within recommended limits. The official upper safe limit is 100 mg per day. But evidence suggests that even 50 mg taken daily over months or years can cause toxicity in seniors whose livers clear substances more slowly and whose nerves are already more vulnerable. Linda, 69, started a nerve support supplement 2 years ago because of tingling in her feet. The supplement contained 100 milligrams of B6 per capsule. She also took a daily multivitamin with another 20 milligrams. Over the past year, the tingling got worse. Numbness showed up in her hands. She had 2 falls from poor balance. When her doctor reviewed her full supplement list, the total B6 intake got flagged as the likely cause. The nerve damage she came to the supplement to fix had been made worse by it. Seniors only need about 1.5 milligrams of B6 per day for women and 1.7 for men. Food sources like chickpeas, tuna, turkey, and bananas provide that amount comfortably. If your multivitamin or any nerve or energy supplement contains more than 5 to 10 milligrams of B6 per serving, flag it with your doctor. More is not better. In this case, more is genuinely dangerous. Now let's talk about the 4 nutrients research consistently supports for seniors. These aren't trendy supplements or new discoveries. They're well-studied nutrients with decades of evidence behind them. And the last one on this list is linked to the most dramatic reduction in overall mortality risk we'll discuss today. Number 1. Magnesium. If there's one nutrient quietly depleted in the majority of seniors and almost never talked about correctly, it's magnesium. Magnesium participates in over 300 biochemical processes in your body. It regulates heart rhythm. It supports muscle function. It plays a direct role in sleep quality, blood sugar control, and nerve signaling. And as we age, the body absorbs less of it from food, while common medications like blood pressure pills, acid reflux drugs, and diuretics actively drain it further. A 2018 study in the journal Nutrients found that magnesium deficiency in older adults was associated with 50% higher risk of atrial fibrillation, increased risk of cognitive decline, and higher levels of chronic inflammation. Seniors who correct a magnesium deficiency frequently report improved sleep, fewer muscle cramps, sharper focus, and more stable energy. The best forms for seniors are magnesium glycinate or magnesium citrate. Both are gentler on your digestive system and more absorbable than the cheaper magnesium oxide found in many basic supplements. A typical range is 250 to 400 milligrams per day, though the right dose depends on your individual health and should be confirmed with your doctor. Number 2. Vitamin D3. D3 is frequently called the sunshine vitamin. But by the time most seniors reach their mid-60s, their skin has lost more than half its ability to convert sunlight into usable vitamin D. Add in more time spent indoors, use of sunscreen, and geographic location, and deficiency becomes remarkably common. Vitamin D3 isn't just a bone nutrient, though it does play a critical role in calcium absorption and fracture prevention. It functions more like a hormone, influencing immune response, mood regulation, and cognitive function. Research consistently links low vitamin D levels in older adults to increased risk of respiratory infections, depression, and accelerated cognitive decline. But here's the detail most people miss. Vitamin D3 is fat-soluble. Taking it on an empty stomach or with a meal that contains no fat dramatically reduces how much actually gets absorbed. Taking it alongside a meal with healthy fats like eggs, avocado, olive oil, or nuts can increase absorption by a factor of 2 or 3. For seniors, this single adjustment can be the difference between a supplement that works and one that passes through without doing much at all. Dosing should be guided by blood levels, specifically a 25-hydroxy vitamin D test, and managed with your healthcare provider. Number 3. Omega-3 fatty acids, particularly EPA and DHA.
These aren't vitamins in the technical sense, but they function as foundational anti-inflammatory agents in your body. And for seniors dealing with chronic low-grade inflammation, one of the driving forces behind heart disease, cognitive decline, and joint deterioration, omega-3s are one of the most well-supported interventions available. Research published in the American Heart Association's journals indicates that regular omega-3 intake may help reduce triglyceride levels, support healthy blood pressure, and lower risk of cardiac events. Separate research has linked higher omega-3 levels to slower cognitive decline and reduced risk of depression in older adults. The primary food sources are fatty fish like salmon, mackerel, and sardines. For those who don't eat fish regularly, a fish oil or algae-based supplement providing 1,000 to 2,000 milligrams of combined EPA and DHA per day is commonly discussed, though dosing should be reviewed by a doctor, particularly for anyone on blood-thinning medication. And now here's the one we've been building toward: the combination of vitamin D3 and magnesium together. Individually, both are powerful. But research examining what happens when both are corrected simultaneously in seniors who are deficient in one or both has produced remarkable findings. A landmark study published in the British Medical Journal found that seniors who maintained adequate levels of both vitamin D and magnesium had a 36% lower risk of death from all causes compared to those deficient in either. That's not from a single small study. It's drawn from large-scale analysis and referenced across multiple subsequent reviews. The reason the combination matters so much is that magnesium is required for your body to activate and use vitamin D. Without sufficient magnesium, vitamin D cannot be converted into its active hormonal form. So, taking vitamin D alone without addressing magnesium status leaves a critical gap. And taking magnesium alone without vitamin D means a key piece of the activation pathway is missing. Together they function as a system. And the data on that system is among the strongest in senior nutrition research. So here's where we land. For vitamins that research suggests seniors should approach with serious caution. Retinol form vitamin A, iron supplements without confirmed deficiency, calcium taken alone without D3 and K2, and high-dose vitamin B6. And 4 nutrients among the most well-supported for.